Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talking about the lymphatic system. Now we'll talk about the lymphatic organ, that is thymus. So the thymus is an asymmetric bilobed organ where T lymphocyte or the T cells are formed. It is located in the superior mediastinum just behind the manubrium. It may descend into the anterior mediastinum to lie between the sternum and the pericardial sac. Sometimes it may ascend into the neck, reaching as high as the thyroid gland. And the fibrous capsule that surrounds the gland sends connective tissue trabeculae into the gland dividing into the lobules. Each lobule is formed of a dark outer region with immature T cells, that is the cortex, and the inner lighter region with mature T cells, that is the medulla. So this figure represents the histology of the thymus, that the thymus contains the lobule, capsule, cortex, medulla and the trabeculae and the blood vessels. And these figures show the position of the thymus, that is present in the superior mediastinum. Above it is present the superior vena cava, brachiocephalic vein, right common arteries, trachea and the thyroid gland, and it is present between the toe lungs and superior to the heart, that is the parietal pericardium. So the thymic tissue is the most numerous in younger age. As the person grows, this tissue is gradually replaced by fatty tissue. Next are the red bone marrow. So red bone marrow is the site of the formation of the blood elements RBCs, WBCs and platelet. And inside the red bone marrow, B lymphocyte forms and mature. But T lymphocytes are formed in the red bone marrow, but they are immature. To mature, they are transferred into the thymus. And the red bone marrow is adult is present in the flat bones and the epiphyses of these some long bones. Next are the lymph nodes. Lymph nodes are the capsulated bean-shaped structure that are found along the course of the lymphatic vessels. They are usually present in groups and they are scattered all over the body. The capsule sends trabeculae into the node, dividing it into compartments. Beneath the capsules, there is a space called the subscapular sinus. The node has an outer cortex with lymphatic nodules formed of B cells and plasma cells. Deep to it is an inner cortex formed of T cells with no nodules. Deep to the cortex is the medulla, which contains B cells, plasma cells, macrophages embedded in reticular fibers. Between the lymphatic tissue in the cortex and medulla are spaces called cortical and medullary sinus. Next is the important note. In any organ in the body, the tissue forming the organ can be divided into two types, that is the parenchyma and the stroma. Parenchyma is any tissue in the organ responsible for performing the function of the organ. For example, in the lymph node, the lymphoid tissue is the parenchyma. The stroma is the tissue in the organ that are not related to the function of the organ but play a supporting role. For example, in the lymph nodes, the capsule, the trabeculae and the reticular fibers and fibroblast are the stroma. Thank you.